Senator from Nevada.
I ask that the quorum call be dispensed with.
Without objection.
Thank you, Mr. President. Last summer, the Supreme Court nearly upheld as a tax the massive government takeover of health care in America, known more commonly as Obamacare. Since then, as the law's provisions have slowly been implemented, the size and scope of this colossal monstrosity has become clear. I opposed the Obamacare bill from the very beginning as a member of the House of Representatives serving on the Ways and Means Committee. Back then, Americans were told that Congress needs to pass the bill before they could know all that was in it. But the more the American people learn about it, the less popular it becomes. In fact, news reports tell us the administration is now looking for help from Hollywood celebrities to push a bill that many Americans clearly do not support. That tactic's been used before. In the 1950s and the 1960s, Hollywood and some athletes were used to sell and glamorize tobacco products. Today, Hollywood and some athletes are being asked to peddle the Affordable Care Act, perhaps to make up for past sins. And while the American people grow more uncomfortable with this law, the administration has allowed for $54 million to be spent on navigators to help push people towards this program. Reports have suggested that there will be 175,000 of these so-called navigators whose job it is to facilitate this law. Add that to the 16,000 new IRS agents that are being hired to implement Obamacare, it's become even clearer now just how flawed this law is. It is being widely circulated that the administration is willing to spend nearly $1 billion on advertisements to entice the American people into buying something that they don't want. The president's recent decision to delay for another year the law's mandate on employers and small businesses more compelling evidence that the Obamacare approach to health care reform isn't working and is only going to make matters worse. It's remarkable that the same day the administration pushed so hard for this health care takeover is now hesitant to put in place the very measures contained in the law, but I think the administration has a very good reason to be hesitant. Since Obamacare's inception, middle-class families have seen their premiums skyrocket by an average of $2,500. Nearly 75% of small businesses in this country have been forced to fire their employees or cut their hours and turn full-time employees into part-time workers. In fact, just last month, 322,000 workers were forced into part-time employment. So the administration has created quite the balancing act for the middle-class families. At the same time they're dealing with increased health care costs and higher premiums, they're confronted with reduced work hours and the threat of being forced into part-time positions. I say that's an unacceptable situation to put the American people in. Clearly, at a time when we're approaching 5 straight years with unemployment rate over 7.5%, Obamacare's job-crushing provisions are only making things worse for our economy, and that's why the administration is having second thoughts. Mr. President, no one argues that the healthcare system in this country is perfect. There are absolutely steps that we can take to increase access to high-quality, affordable health care. But Obamacare's massive expansion of the federal government's role in the healthcare industry isn't turning out to be the solution its supporters said it would be. That's why the architects of the legislation are cherry-picking which parts of the law to enforce, delaying some of its key provisions. It's obvious this legislation is well on its way to collapsing under its own weight, and that will only further hurt the American people and cause even greater damage to our economy. Mr. President, I have a 3-part test that I've told my constituents about countless times. It's a test that I apply whenever I evaluate legislation, and it's called the more, higher, less test. When legislation hits my desk, I evaluate whether that bill will lead to more competition, higher quality, and less cost, hence the more, higher, less test. If the bill passes the test, then it's a bill that I will consider supporting. That test is rooted in my belief that the American that the American free market system has created the world's greatest economy and allowed innovation and creativity to thrive. Competition is a key to improving our healthcare system, not burdensome regulations and mandates, especially when they're selectively enforced by government bureaucrats. Perhaps the Obama administration has the same concerns about Obamacare that I have, and that's why they'd rather not fully enforce it until after the next election. But if that's the case, they need to make the tough decisions to address the problems instead of pretending that those problems don't exist. When I was recently back in my home state of Nevada, I toured a medical school and spoke with a number of bright, hardworking students who expressed serious concerns about the effects of Obamacare. I told them that one of my biggest fears was that the law would turn them all into government employees and it would put a bureaucrat between them and their patients. Instead of a system like that, we need to reduce the cost of healthcare services by enacting meaningful tort reform, making insurance more affordable, and providing market-based solutions to meet consumer needs. And we need to create an atmosphere that will foster economic growth and job creation instead of punishing the middle class with higher healthcare premiums and fewer hours at work. I can understand Obama's administration's decision to delay the employer mandate that is crushing small businesses across the country. That's why so many of us opposed the law to begin with. But the American people deserve far better than a cherry-picking, tax-increasing approach to health care reform. American families shouldn't have to juggle higher health care premiums with the threat of losing their jobs or losing hours at work. They deserve common-sense solutions that will reduce costs and increase access to high-quality care. Obamacare clearly is not that solution. Thank you, Mr. President. I yield the floor. I suggest the absence of a quorum.
The clerk will call the roll.